Welcome to this brief video series on compassion-focused therapy, where we'll be thinking about how to help us to understand, recognise and be kinder to ourselves about the things that we find difficult. It's based on the work of Paul Gilbert, who is the founder of compassion-focused therapy. The video today will be taking a look at how we can start to make a bit more sense of our responses or of how we respond to the things that we find difficult. So, in more detail, we'll be looking at what are the experiences that we've had in life and how they might connect with present-day problems. We'll be looking at what information can be helpful to identify and talking through some examples, and how to pull it together to help make sense of our situation. Now, taken together, a compassion-focused therapist would often refer to this as one of the ways that we can develop what's called a formulation, but I just like to think of it as maybe how we just make sense of our story. Now, it does come with a warning to think about, if we're looking back over the things that we find difficult and looking back at our lives, that could be tricky for us. So please be mindful and thoughtful around how you look after yourself, whether that's pausing and taking regular breathers as you go through, or maybe working through this alongside someone that you feel comfortable with. So, I think the first point that's really helpful and important to acknowledge is that the people, human beings, we don't come with an instruction manual. We basically land in the life that we get born into, and we just have to figure out how to cope and get on as best as we can. Now, the way that we learn about ourselves and the world around us and other people is really through the experiences that we have in life. So the start point for this formulation, and we will go through each of these in more detail, is what are the experiences that have shaped us? As a result of those experiences, the second thing that we'll be looking at is, what are the worries, fears and concerns that I have as a result of that? Then, as is completely understandable, thinking about, what are the ways that we've tried to cope or to protect ourselves from the things that we find worrying? And lastly, it'll be looking at what are the unintended side effects of our ways of coping, how that's developed over time. Okay, so going through then each in turn. Firstly, looking at what are the influences or the experiences that we've had in life that have really shaped us. And these can be both big or small, so people might have automatically a few really big or serious or really challenging things that come to mind. Certainly include those. If you don't want to write them down, you can just reference them in some way that makes sense to you. But I would also invite you to think about what are the things that might be smaller, but perhaps just happened over a really long period of time. So things that have chipped away at our identity and our sense of self. Now, there could be a number of sources for experiences. I've put up a few, but certainly this is just to, activate our thinking rather than limiting it. So have a think about what were your early family experiences? What are the narratives within your family? How did you see yourself? How did your family treat you? Were the oldest? Were you the youngest? And was that relevant in some way to shaping how you've come to see yourself? What were your experiences at school like? Were there parts of your identity that were particularly drawn attention to? What were romantic relationships like? Were there important things about friendships that have really shaped or influenced you? Experiences with work or career. And it might not be these specific fields, but it might be significant events, like significant losses in life that might really have shaped us. So be thinking firstly about what are the things that have really affected the person that I have become. What we then want to think about, and please feel free to take a pause and come back to this after a bit of a break, is what are the worries, fears and concerns that I have that those experiences taught me? And we might think about this in two different ways. Firstly, the distinction between internal things. So that might be how I see myself. So things about my identity, things about my ability to cope or handle difficult emotions, specific memories that might come back to me in quite an intrusive way, and things like that. So it's about how I see myself. The second one is called an external. So that is, what are we thinking of or concerns about how other people may react to us or treat us, think or feel about us. So might they reject us, ridicule us, exclude us, abandon us? Can people be trusted? Are they safe? And all of those things. Now, if that feels a little bit too complicated, feel free just to sort of think about this as one block, but it's again just can be helpful to think about some of the distinctions. Is this something that I think about myself, or is this something that I worry about other people maybe thinking or doing? So, as would be understandable, thinking about, well, we have a series of things that cause anxiety for us. What did we learn to do in order to cope with those? And there's a number of examples here, but by no means is this exhaustive. So depending on what the things are that we find threatening, we may have learned that hiding from our feelings was a good way of coping with that. Maybe it was about pleasing others, keeping the peace, keeping harmony. Maybe it's about overthinking things, or maybe after an event going back over it in your mind and really trying to work out, was there anything that I said or did that I shouldn't have? Maybe it's about keeping people away or pushing people away, if that helps in the short term at least to feel safer for you. It could be maybe about using distraction or zoning out, and that could come in a lot of different forms. Some people use alcohol or drugs, some people use TV or maybe food as a distraction. Staying in control, maybe that's a way that we learn to cope that helps us to feel like we're managing with the things that we find stressful. Maybe it's about doing risky things, thrill-seeking. Maybe it's about exercising excessively or doing anything excessively, cleaning, organising. For some people, maybe we seek a lot of reassurance. We're checking in with other people a lot or apologising. Maybe we're avoiding making decisions, just going with the flow. Or maybe we're deliberately hurting ourselves. Now, all of those things in the short term may have felt helpful. And I guess that it's about validating how much sense that makes. So if a coping strategy helps even a little bit, even in the short term, we are likely to repeat it. Patterns that get repeated, and then they become more like habits. Then we seem to do certain things or behave in certain ways without consciously knowing that we're doing it. It almost seems to happen automatically, like it's a habit. So when habits feel like automatic responses, it can be hard to hold on to the hope that we might be able to do things differently. But with time and effort, we can. So we've had difficult experiences that have shaped us. These have led or have given rise to certain fears or things that we find threatening or anxiety-provoking. We've learned the best ways that we can to cope with those or to protect ourselves from them. And over time, these have become patterns of ways of responding that really might feel quite entrenched. So the last section that we look at is thinking about the unintended side effects of our ways of coping. Now, for many people, this is what they might talk to someone about as these are the problems that I have in my life. And again, just a few examples, but by no means exhaustive. It might be that our needs get overlooked or ignored. We might end up feeling isolated, might develop problems with addiction, whether that's gambling, alcohol, drugs, food. We might damage our bodies in different ways. We might become highly self-critical as a result of the ways we've learnt to cope over the years. We might find that the things that we've done to protect ourselves or cope might end up damaging relationships or losing us work opportunities. Or we may have started to lived a very limited lifestyle, so that comfort zone might feel really very small. We might be filled with anger or other difficult emotions, anxiety, sadness, shame. We might feel like no one knows the real us. So when we think about what are the things that are problematic now, it can be helpful to look back and be kind to ourselves about the fact that actually the things that have led to this particular problem stemmed from me just trying to cope the best that I could with a certain situation that I found myself in. So what do we do with this? All people develop patterns of coping. So what can we do about it? Well, there's no quick fixes. If this was easy to change, then people would have already just changed what they wanted to and moved on with their lives. So the first step is really just to start to notice. So moving out of autopilot and just starting to notice when maybe we played out a pattern or relied on a coping strategy that might have some downsides to it. And then it's about paying attention to what that pattern is, being kind to ourselves about what we're struggling with. And one of the ways to do that is to think about what is the intention of that coping strategy. What am I trying to do to help myself, even if it doesn't end up being helpful? The last point is really what we would then start to think about in compassion-focused therapy. How to build our capabilities in being more compassionate so that in time we can apply these to the situations that we find difficult. I would certainly say a lot of this is thinking about the distinction between short-term relief from a particular worry or anxiety versus longer-term problems that it causes. Now, until we have better ways of doing things, or we feel like we have more capabilities or resources or choices, it's really hard to just stop doing something that, even if it's in an sort of an unhelpful way, it does do something to provide some relief. So we want to build up the skills so that we feel we can better tolerate the distress that we're experiencing and have more options and more flexibility in how we respond to situations. So this is a gradual process of using compassionate mind training to build up the skills and resources just to be able to approach things differently. And feel free to look through the other videos to get some more information on that. And in the meantime, I'm sending you good wishes.